Today we have received a total of 957 results from the laboratories, and out of this, 99 samples test positive for COVID-19. 49 are males and 50 are females. The youngest one is 7 months old, and the oldest one is 83 years old. They are distributed as follows: Commas, Windhoek, 60. Oshakati, 6. Rehoboth, 5. Wolf's Bay, 4. Usakos, 1. Onanjokwe, 4. Omthia, 1. Engela, 3. Enhana, 2. Keetmanshoop, 3. Karasberg and Loderitz, 1 each. Okakarara, 2. Okahanja and Ochvarongo, 1 each. Otapi, 2. Rundu and Hobabis, 1 each. Total, 99. We do take note of the number of confirmed cases among students, learners, and teachers. Out of the total of 9,818 confirmed cases since the beginning of the epidemic, 732, which comprise 7%, were reported from educational institutions in 11 regions. 632 learners and students and 100 teachers. The majority, which is 400 or 55%, were reported from Commerce, followed by Erongo with 149, and which comprised 20%, while Hardap and Karas regions recorded 27, 4% and 24, 3% respectively. Few cases were reported from other regions except Kavango West and Kunene regions. We continue to monitor the situation in school and will advise the educational institutions accordingly and as appropriate. Today we are reporting 150 new recoveries, which brings the total number to 6,693. The recoveries for today are as follows: Erongo 130, Karas 12, Hardap 6, Omaheke 1, and Oshana 1. The total number of active cases now stand at 3,023. Of these active cases, 19 are in severe or in critical conditions. In Erongo, we have 1 severe and 4 critical cases. Commerce, we have 5 severe and 8 critical cases. Oshana, 1 severe case. It's regrettable that today we are announcing 2 deaths, all from Windhoek. These 2 deaths bring the total number of COVID-19 deaths and COVID-19 related deaths to 103. It was on the 13th of September, that is yesterday, that we crossed the 100 mark of deaths. Now, our case fatality stands at 1%. Our case fatality ratio stands at 1%. The deaths which we are announcing today is from Windhoek are: 1 is a 57-year-old male who died on the 14th of September in a hospital, and this is a COVID death. And the second one is a 64-year-old male who died on the 7th of September in a hospital, and this is also a COVID death. We do express our heartfelt condolences to the bereaved family and to the nation at large. Currently now, in terms of summary, we have 9,818 cases of COVID-19 in Namibia since the beginning of the pandemic. and 6,693 recoveries. The active cases stand at 3,202, and as I mentioned earlier, the death toll has climbed to 103. Total sample tested thus far is 81,307. Active contact, 9,844. So far, we have hosted in our quarantine facility a total number of 12,232 individuals, of whom 11,173 were discharged, which leaves us with 1,059 individuals in our quarantine facilities all over the country. Before I conclude, I would like to address a certain narrative that is being circulated via social media, purporting that the Ministry of Health and Social Services is carrying out mandatory vaccinations with an unspecified so-called injection, apparently that are announced a few days ago. This allegation is dangerous and must be rejected with utmost contempt. The medicine remdesivir, which I informed the public about, is used for the treatment of patients with COVID-19, as I have indicated earlier, and as it was clearly explained during the panel discussions a few days ago by our health experts. I want to emphasize again that remdesivir is not a vaccine. Despite the presence of COVID-19, the Ministry of Health and Social Services is carrying out normal programs and activities of the ministry. One of such activities is the periodic intensification of routine immunization activities, which embodies maternal and child health and the African Vaccination Week. The two immunization weeks have since been internalized and implemented every year and form part of the ministerial events calendar. The main aim of the periodic intensification routine immunization is to increase utilization of quality mother and child health intervention, that is family planning, maternal, neonatal, and child health services, improved nutrition and water, sanitation, and hygiene practices. The focus of the events has been to screen and vaccinate children and women of childbearing age that were missed through routine services as guided by routine immunization data. Other maternal and child health interventions, namely vitamin A supplements, deworming, nutritional assessment, counseling, and condom distribution, were also added to the package. The audio that I referred to above seeks to instill fear in the public and to dissuade the Namibians to uptake these health services. I call on the public to maintain their faith and trust in the government that is working tirelessly to ensure that their health and well-being are safeguarded. I also call on individuals to desist from making and circulating such misguided information that have the potential to cause fear and despondency in the public, and not to expose themselves to criminal proceedings, as such activities are, according to our law, criminal offenses. With this, I conclude my update, and I thank you.